There are several things that make UVA Dermatology special. I believe it's the people. It starts with people and it ends with people. We recruit from all the areas. We have people with a diverse background of interests, and we hope to create leaders. We choose the best people and then get out of their way.
The educational curriculum at the University of Virginia is diverse in nature. You experience all aspects of dermatology in a hands-on fashion and a one-on-one relationship with an attending physician. You're taught dermatopathology at the scope, signing out your own cases. You are the first assistant in Mohs surgery. You often become the primary surgeon in Mohs surgery. You're doing cosmetic sessions. You are doing pediatric dermatology. In all these aspects, you are right next to the attending and eventually making the decisions for the patients. And so it becomes a unique experience to be able to have that one-on-one relationship with faculty.
UVA is a fairly small program, so it has a lot of family feel. Everyone is warm and welcoming and basically wants you to be able to pursue what you want out of your training and out of your career.
I think one of the greatest things we have to offer here is a wide variety and diverse patient population. A huge catchment area that goes into Southern Virginia, West Virginia, and Northern Virginia, which are very different places and get very different kinds of patients. We really stress mentorship here at the University of Virginia Dermatology program. And that's not just mentorship in career, but everyday mentorship in the art of medicine. You get a nice blend of clinics that are done with attendings and faculty that allow you to see other people practicing their art. And then you get your own clinics, continuity clinics, that allow you to kind of spread your wings and learn how to use the facets of that medical practice that you've taken from the faculty and blend them into your own style. And by the third year of your practice, you'll be practicing very independently and comfortable with that, and be interacting with patients as their doctor, which we love to see.
I've actually been here for 49 years, which is over 50% of the time that the Department of Dermatology has been in existence. The major things that have stayed the same include the fact that we teach on one site at the grounds at the university, and we have faculty that satellite around the community, but the residents train in the same location. So a huge advantage is if we have an exciting case that everybody gets to come out of the room and go in and see that case.
Our program's experience in dermatologic surgery is on par with any program in the country. In your first year, you'll have the opportunity to operate with a chief resident under their guidance. That will progress in your second year to having a second year surgery clinic where you're running the show and really booking patients into that from your own continuity clinic, perhaps doing some other procedures for other folks. And then when you're a chief, you will then take the torch and really start to train the first years. All that, of course, is augmented with one-on-one surgeries with our faculty who are all eager to teach, as well as 5 dedicated months of training with our Mohs surgery staff and faculty, myself and Dr. Russell.
We have a number of training opportunities for dermatologic surgery here at the University of Virginia Department of Dermatology. It starts, very importantly, with the introduction to dermatologic surgery that they get by not only watching their attendings perform these procedures, but also the cutaneous surgery lecture series, which is composed of about 30 lecture discussion sessions throughout the year. It starts in July, and one of the favorites for both the attendings and the residents are cutaneous surgery labs, where the residents sit down stratified by their year with a skin simulant, and they can perform many of these procedures in a low-risk or no-risk environment, while at the same time being able to ask questions of their attendings at the time. And hopefully in doing this, they develop good habits that will serve them for the rest of their career.
Our department sponsors several multidisciplinary clinics with the goals of providing the most up-to-date and comprehensive care to patients. In addition, they serve as a platform for exploration and career development of our faculty and residents. Dr. Slotoff leads the combined dermatology and allergy and immunology clinic, as well as a vascular anomaly clinic. Patients are seen from various states for care. The Cutaneous T-cell Lymphoma Clinic, led by Dr. Cropley, is held at the Cancer Center and provides infusion support and access to photopheresis. In partnership with Dr. Carlson, a rheumatologist, Dr. Hal Flowers leads the Derm Room Clinic and evaluates and treats perhaps the most complicated patients we see. Dr. Wilson leads the Vulvar Dermatology Clinic, and Dr. Young has endeavored to provide care for the transgender population in very specialized clinics. The clinical experiences are meant to stimulate the most exciting time of a physician's training, your residency program.
My training experience here at UVA was amazing, in one word. It really was very rewarding, challenging, and a lot of fun all at the same time.
Deciding to stay at UVA Dermatology as a faculty member after training here was the easiest decision that I've ever made. I think the future of UVA Dermatology is extremely bright, and each year the dermatology department continues to grow, continues to offer more opportunities for our residents, more opportunities for our patients, and I'm really excited to see what the future brings. Living in Charlottesville is one of the really special things about being able to train at UVA, and I think that all of our residents really love the city itself. There's tons of activities to do. You have the University of Virginia here, of course, with all of its athletic events and cultural events and arts. You're right here nestled in the mountains and have easy access to Shenandoah National Park and all the hiking and camping you could want. There's great food, great events here. We have an awesome farmers market, and generally just really great people here.
But the common thread through this whole process has been that we teach medical and surgical dermatology, and by the time the residents finish their training here over a period of 3 years, they can go out into the world and treat most any type of skin problem that develops.
At the core of bringing all these various opportunities is our understanding that diversity makes us stronger, that it helps us understand what our patients need, and that we can tailor a wide array of services so that no one is left behind.
It's really important to us that you figure out what kind of doctor you want to be. We've had physicians who get interested in policy. We've had physicians who get interested in global health. We've had dermatologists who have become entrepreneurs. We want you to explore the facets of your career that will bring you meaning and make you the physician that you've always dreamed of being through medical school. Residency is the time to do that and make that leap from becoming a student to becoming the practicing physician that you've always dreamed of being.
I welcome you to learn more about our department. We would be lucky and happy to be part of your journey.